Nutrition has built an artificial intelligence platform to help people over 40 reverse cardiovascular diseases in 3 months. Cardiovascular diseases affect 1 in 3 adults over 40, which are 400 million people globally. They are the root cause of major illnesses such as kidney cancer and heart attack. $33,678 is spent per patient per year. Complications such as a heart surgery can easily cost $500,000 per patient. Today, physicians focus on secondary prevention after clinical markers have worsened significantly. They spend just 15 minutes per patient. As they know very little about nutrition, they have become pill merchants. When patients complain of side effects, they prescribe even more pills. Today's nutritional guidelines assume everyone has a 2000 calorie diet. As vitamin and minerals are specified as a percentage of this basis, even their intake is misdirected. Most diets give generic guidelines such as eat more fruits and vegetables. Nutritionists have just a single nutrient focus, such as protein, but the same foods they recommend could increase cholesterol and diabetes. What patients need are recommendations that take into account their age, sex, dietary preferences, and balance all 44 nutrients. My mom was a cardiovascular disease patient who suffered through medication and nutritionists, and I was determined to find a cure for her. So using AI, I created 2 solutions. The first solution creates individually customized weekly meal and exercise plans. Our recipes are suitable for the entire family and take 30 to 45 minutes to prepare by novice cooks. The second solution helps corporations, schools, and restaurants optimize meal plans. Our 4 trade secrets include how we used AI to customize nutritional targets for individuals. Our patents specify exact quantity of food to be eaten to create the 100% balanced diet, create meals that maximize our fullness index, and optimize workouts. Our technology is based on clinical trials in more than 4,500 people. They have been published in more than 100 peer-reviewed journals and follow all US federal guidelines. 71% of people got off and 29% saw significant reduction in medication. Now I will discuss how cardiovascular disease patients and athletes use our solution. To begin our program, patients report their macro measurements and clinical measurements. Blood pressure, total cholesterol, and fasting blood sugar are the most economical blood tests. The clinical diagnosis is based on their individually customized targets, which are based on intellectual property. Next, patients report their food diary over the prior 2 weeks. Then, nutritional diagnosis is carried out across 44 nutrients based on our individually customized targets. We are the only healthcare company that can individually customize 13 macros, 13 vitamin, and 18 mineral targets. Our recommendations start by suggesting easy substitute, then superfoods are added, and finally meal prep recipes are shared. These recipes are suitable for the entire family and take 30 to 45 minutes to prepare. Similarly, we ensure all the individually customized heart rate zones are hit while exercising. Unlike weight loss programs which cause weight crashes and then gaining everything back, our patients saw steady and consistent improvement. Blood tests at Memorial Hermann Hospital in Houston, Texas, one of the largest hospitals in the US, revealed how our program has led to cardiovascular disease risk becoming a quarter in just a few weeks. Similarly, our athletes improved their cardio recovery. Their resting heart rate dropped to 54 beats per minute, which increased their life expectancy by 25%, and they beat Boston Marathon runners and Ironmen, the toughest amateur competitions in America. Today, there are 158 million obese children globally, which is expected to grow to 250 million by 2030. To prevent and reverse childhood and adult obesity, now I will discuss how we make meal plans for school and corporate canteens. Here, our analysis of the most popular dishes at various restaurants show how they can lead to hypertension, cholesterol, and diabetes. Here, by substituting ingredients in a typical breakfast recipe, we reduced cardiovascular disease risk by 17%. We intend to optimize menus in corporate and school canteens. Currently, we are working with the National Food Safety Institute in the Yangtze Delta Institute of Tsinghua University to prepare a proposal for primary schools in the region. While weight loss programs just reduce calories, which cause fatigue, our recipes maximize fullness index, which increase energy levels during weight loss. Moreover, our recipes take just 30 to 45 minutes to prepare by novice cooks. Dietitians simply do not have 44 individually customized nutrient levels. Our competitors make patients feel they are on a special diet, which is very isolating socially. As our recipes improve the health of the entire family, we use the patient as an agent of change for his or her community. Thus, through our patent-pending algorithm, we create the 100% balanced diet. Cardiovascular apps require clients to log everything in their food app, which takes 6 hours per week and is very inconvenient, so they have very poor compliance. Only 5% of people use food journal apps in any case. We can create and customize program through just 15 to 30 minutes per week questionnaires, so have 4 to 5 times higher compliance. Our cooperation partners include physicians, hospitals, self-insured employers and insurance companies, diagnostic labs, gyms, and wellness centers. Precise Nutrition can save 50 to 75% of healthcare costs in year 1 and 90% in subsequent years. As clinicians' time gets freed up, they can treat even more complex diseases, which increases their revenue by 30%. As we order blood tests every 3 months, diagnostic labs increase revenue 300%. Our service becomes a value add to gyms and wellness centers. Here are some examples of our menu items. All of our recipes keep clients feeling full for hours with high amounts of protein while minimizing cholesterol, sugar, and sodium. Testimonials have been glowing from both cardiovascular disease patients and athletes. Women love us because we improve the health of their skin, nails, and hair. I have 15 years of experience in artificial intelligence with a PhD research applications in personalized medicine. I've been interviewed in American Scientist magazine and appeared in Forbes 30 Under 30. Alfonso has 17 years of experience in international governmental relations and has been awarded many friendship awards. Zheng Feng has over 10 years of experience in marketing startups and was part of the Hangzhou Future SciTech City where Alibaba got incubated. Jane is a liaison at the Premier Innovation Hub in Hangzhou. Dr. Reiser works at TMCX, the largest medical center in the world. Andrew has worked at MD Anderson, the largest cancer hospital in the world. Dr. Tan is a surgeon with an extensive background in community healthcare in the US, Hong Kong, and Africa. Dr. Malad was part of the team which created the world's first artificial pancreas, and Virginia is a health coach who has worked closely with chiropractors and orthopedic surgeons. Precise Nutrition has graduated from Y Combinator Startup School, the top accelerator in the US. We are currently in discussion with the National Food Safety Institute at the Yangtze Delta Institute of Tsinghua University and are about to begin clinical trials in cooperation with the Health Secretary of the 50 million resident Jiexing province. In June 2019, we presented at Nanjing Tech Week, VMware, Jinan in Shandong province, Hangzhou Future SciTech City, the incubator of Alibaba, and CPC Secretary Zhang Bing, the leader of the 50 million Jiexing province, wanted to be our first clinical trial patient in China. In September 2019, we initiated discussions with Robam, the largest manufacturer of kitchen appliances, got approval for clinical trials, presented at the Hangzhou Overseas Talent Conference, and got a business license to operate in China for 100 years. If you're wondering about my mom, yep, she got completely off medication in 3 months. We can cooperate in the following ways. If you or someone you know would like to try a pioneering technology to reverse obesity, hypertension, cholesterol, or diabetes, if you would like to initiate a pilot study in your company, hospital, or insurance company, if you'd like to invest in our company, with your cooperation, I'd like to help 400 million people globally reverse blood pressure, cholesterol, and diabetes in 3 months and improve the life expectancy by 25%. Thank you.